Hello, this is Dr. Gay from First Look MRI, and these are two patients, both from today, that had similar findings, so I'm going to show them together. And this is the first one. She's 41 years old, has knee pain, had been running recently, felt pain, so they came in and got x-rays, and x-rays look just perfectly normal, no abnormality. This is a sagittal view or side view, lateral view, and we can see the femur here, kneecap, tibia, fibula. The bones look nice and normal. So they did an MRI because the pain persisted and saw this. The patient has this is a non-aggressive bone lesion here, just probably a benign lesion we call an enchondroma, incidental, but it's interesting how such a big lesion doesn't even show up on the x-ray. And the main finding was down here below the knee where they have bright signal. This is called a proton density fat suppressed sequence. The marrow should be dark here. Fat is suppressed and marrow has lots of fat, so it should be dark. Like this femur is very dark, the kneecap's dark. Well, this is bright. That means it has granulation tissue or edema within it. And this is a stress fracture of their tibia. And over here we see a popliteal cyst in the back. So they had significant findings here. They're just invisible on the x-ray. So here's that benign bone lesion. This is the stress fracture of the tibia. Again, the femur's up top, tibia is down below. And we see this band or broad region of brightness within the marrow space. You can see a little linear band there. That's the subtle non-displaced fracture or stress fracture line there. This is the marrow edema around it. So a stress fracture of the medial tibia. And again, that's just invisible on this x-ray here. And this is another patient. She's 15 years old. She's a gymnast. Her knee was hurting with gymnastics, so they went and saw the orthopedic surgeon. The physical examination was not bad, so they thought it was almost within normal limits, just a little bit of pain, and there was no significant joint effusion, so they were instructed to just continue on with the gymnastics and come back if they needed to. But the mother wasn't convinced that there may not be something hiding in there, so she did an MRI and found that there was marrow edema here in the tibia. So this is another tibial stress injury, and this patient has a growth plate here, the femur, growth plate here, the tibia, so there's no growth plate widening, and the marrow edema is on both sides here. And we'll put up a sagittal view, a side view. Here we can see the marrow edema here and the epiphysis. This is the growth plate, the physeal plate, and here's the metaphysis below that. And we can see a little bit of buckling of the cortex here in the front, and there's a little bit of the periosteum here is elevated back off. So this is all marrow edema from a stress fracture. And they were right, there is no significant joint effusion up here, which is interesting, but she did have a popliteal cyst in back here. So kind of like the last patient, a tibial stress fracture and a popliteal cyst. And she had x-rays that were normal. And again, apparently a physical examination that wasn't all that tremendous. But because this is here, she definitely needs to stop her gymnastics, because if she does not, this can go into fracture, or it can injure the growth plate and cause serious problems. So she's going to go back and see her surgeon and get some advice as to how long to stay off of it. And it should heal completely just with conservative therapy. And that's it. Thank you.